Ever wondered how different respiratory conditions compare to each other? Today, we're demystifying the common cold, influenza, sinusitis, and COVID-19. We'll be going in-depth, examining the causes, symptoms, diagnosis, treatment, and prevention of each. It's a fascinating journey into the world of respiratory infections, one that will equip you with the knowledge to understand these conditions better. So, sit back and relax as we navigate this complex yet intriguing topic. Stay tuned as we delve into the world of respiratory infections. First up, the common cold, a frequent visitor in many households. The common cold is a viral upper respiratory infection that can be caused by a variety of viruses. The most common culprits are rhinoviruses, but we also see adenoviruses, coronaviruses, and even certain types of influenza viruses playing a role. Now, the common cold is quite a chameleon, presenting a broad array of symptoms. These can range from sneezing, nasal congestion, and a sore throat to a cough, a general feeling of being unwell, and even a low-grade fever. The severity and combination of these symptoms can vary greatly from person to person. So how do we identify a common cold? Well, diagnosis is primarily based on the presentation of symptoms. There's no specific test to confirm a cold. It's all about piecing together the symptom puzzle. But here's the thing. There's no cure for the common cold. I know, it's a bit of a bummer, but that's the reality. Treatment is focused on relieving symptoms and making you feel a bit more comfortable while your body fights off the virus. This might include over-the-counter medications for cough and congestion, rest, hydration, and good old-fashioned chicken soup. Now, it's important to remember that the common cold is highly contagious. It's spread through droplets in the air when someone with the cold coughs or sneezes, or through direct contact with an infected person or contaminated surfaces. So, practicing good hand hygiene and avoiding close contact with people who have a cold can help prevent the spread. And finally, keep in mind that while the common cold can be a nuisance, it's usually not serious. However, if symptoms persist for more than a week, or if they become severe, it's always a good idea to seek medical advice. Now that we've covered the common cold, let's move on to influenza. Next, we tackle influenza, an infection that can range from mild to severe. Influenza, or as it's more commonly known, the flu, is a highly contagious viral infection. It doesn't discriminate, affecting both the upper and lower sections of your respiratory tract. The usual culprits behind this condition are the influenza A and B viruses. Now, let's talk symptoms. If you've ever had the flu, you know it can feel like you've been hit by a truck. The onset is sudden, and you might experience a high fever, headache, and chills. A dry cough and body aches are common, and general malaise, that feeling of discomfort, uneasiness, or illness, can leave you wanting to do nothing but sleep. So how do we diagnose influenza? Well, it's not just a guessing game. Medical professionals will consider your history and conduct a physical examination. This is often followed by rapid flu screening or a culture test. Remember, the earlier the diagnosis, the better the chances of managing the symptoms effectively. And speaking of management, let's move on to treatment. Antiviral medications can be prescribed, especially for those at high risk of complications. These can include young children, older adults, and people with certain chronic health conditions. Supportive care, like getting plenty of rest and staying hydrated, also plays a pivotal role in recovery. Prevention is another crucial aspect of tackling influenza. Annual flu vaccines are recommended as the first line of defense. Washing hands regularly, avoiding close contact with sick people, and practicing good health habits like covering your mouth when coughing can also reduce the risk of infection. With influenza covered, let's turn to sinusitis. It's another respiratory condition, but with its own unique set of causes, symptoms, and treatment strategies. Stay with us as we continue our journey through the world of respiratory infections. Now let's discuss sinusitis, an inflammation that can cause discomfort and pain. Sinusitis is an often overlooked but surprisingly common respiratory condition. It involves inflammation of the sinuses, those air-filled cavities within our skull that surround our nasal passages. This inflammation can result from a number of different causes, but most frequently it's triggered by a viral infection. Sometimes, though, bacteria or even fungi can be the culprits. When it comes to symptoms, sinusitis can be quite the chameleon, presenting in different ways for different people. Commonly, individuals might experience facial pain or pressure, often concentrated around the nose and eyes. Other symptoms can include a headache, thick yellow or green nasal discharge, and a decreased sense of smell. In some cases, individuals might also experience fever, bad breath, fatigue, or dental pain. So, how is sinusitis diagnosed? Well, it often starts with a careful review of symptoms and a physical examination. In some cases, a healthcare provider might use a thin, flexible tube with a light on the end to look at the sinuses or order imaging studies like a CT or MRI scan. Now let's move on to treatment. The goal here is to reduce inflammation and facilitate drainage of the sinuses. If a bacterial infection is suspected, antibiotics may be prescribed. For viral sinusitis, which is more common, treatment is largely supportive. This can include the use of over-the-counter pain relievers, nasal sprays, and decongestants, as well as home remedies like warm compresses and steam inhalation. It's important to remember that while sinusitis can be uncomfortable, most people recover completely with time and appropriate treatment. However, if symptoms persist or are particularly severe, it's always a good idea to seek medical attention to rule out more serious conditions. Having explored sinusitis, we now move on to the widely discussed COVID-19. Finally, we delve into COVID-19, a respiratory illness that has changed the world as we know it. COVID-19, short for Coronavirus Disease 2019, is caused by a novel coronavirus named SARS-CoV-2. This virus emerged in late 2019 and rapidly spread across the globe, leading to an unprecedented pandemic. The symptoms of COVID-19 cover a wide spectrum ranging from mild to severe, and in some cases can be life-threatening. Those affected may experience fever, cough, and shortness of breath, which are common to many respiratory infections. However, unique indicators like loss of taste or smell, fatigue, body aches, sore throat, congestion, and gastrointestinal symptoms like nausea and diarrhea have been reported as well. Diagnosis of COVID-19, unlike the other respiratory infections we've discussed, involves PCR testing of respiratory specimens. This test detects the genetic material of the virus and is currently the most reliable method for diagnosing COVID-19. When it comes to treatment, most cases of COVID-19 are mild and can be managed at home with rest, hydration, and over-the-counter medicines to relieve symptoms. However, severe cases may require hospitalization, and in the most critical situations, patients may need ventilatory support in an intensive care unit. Prevention strategies for COVID-19 have become a part of our daily lives. These include frequent hand washing, wearing masks, maintaining physical distance from others, and most importantly, getting vaccinated. Vaccination against COVID-19 has been a game changer in our fight against this virus, reducing the severity of the disease and helping to slow down transmission. Although these respiratory infections share some common symptoms, they differ in several aspects. The common cold, influenza, sinusitis, and COVID-19 all cause respiratory symptoms, but their severity, transmission methods, and treatment strategies vary. The common cold and influenza are frequent occurrences, often causing milder illnesses. Sinusitis, while usually less severe, can lead to chronic symptoms if left untreated. On the other hand, COVID-19 stands out due to its high transmission rate and potential for severe complications, necessitating strict infection control measures. Each condition has unique causative agents: various viruses for the common cold, influenza A and B viruses for the flu, a mixture of viruses, bacteria, and fungi for sinusitis, and the novel coronavirus for COVID-19. Treatment approaches also differ, from symptom relief for the common cold to antiviral medications for influenza, antibiotics for bacterial sinusitis, and supportive care for COVID-19. Understanding these differences and similarities can help us manage and prevent these conditions effectively. In summary, understanding the distinctions between these respiratory conditions is vital. We've journeyed through the common cold, influenza, sinusitis, and COVID-19, exploring their causes, symptoms, diagnosis, treatment, and preventive strategies. Each one, with its unique characteristics, reminds us of the importance of accurate diagnosis, appropriate management, and effective prevention measures. So let's stay vigilant, informed, and proactive in our health decisions. By staying informed and following public health guidelines, we can mitigate the spread of respiratory infections and protect our communities.